Good evening, viewers. Hope you all are doing truly well. Truwellth Integrative Health Centers were established with the mission of Sarve Bhavantu Sukhina, Sarve Santu Niramaya, true wealth of holistic health and happiness for all, to reverse, control, and prevent diseases and augment health by integrating all appropriate scientific evidence based personalized nutrition and fitness therapies, functional medicine, and advanced surgical treatments with a holistic approach. This coincides with Prime Minister Narendra Modi's vision of the flagship Ayushman Bharat Health and Wellness Centers initiative. Integrative healthcare does not mean alternative medicine. At True Wealth, eminent medical doctors, surgeons, personalized nutrition, and fitness experts focus on the patient as a whole and identify and address the root cause and bring about true relief from diseases by combining ancient wisdom with modern science and bringing about a deep collaboration among health practitioners from multiple disciplines to create a comprehensive health ecosystem to help patients meet all their health needs, physical, emotional, as well as social. Me being the founder of True Wealth and celebrity nutrition expert with 24 years of rich global experience across continents, I firmly believe that nutrition can be modern day's most effective and safe therapy of lifestyle, autoimmune, as well as infectious diseases. With MBA in marketing and a master's from Scion Hospital, postgraduate from the Symbiosis University, I've worked across therapy areas helping many in reversing, controlling, and preventing various ailments, especially digestive diseases, diabetes, PCOS, weight loss, weight gain, arthritis, and more. Today, we are actually going to tackle a very difficult disease, which is irritable bowel syndrome, that is IBS. Uh, One of the most difficult ones to cure. This disease was once thought to be psychological and now is better understood, I would say, as psychosomatic, which is why it needs a more integrated and personalized approach. Besides, there have been a lot of advances in the medical treatment and nutrition and nutraceuticals approach in managing and overcoming IBS. I'm sure this program will help you gain a holistic understanding of the disease and treatments for managing IBS and bringing about more hope in reducing the disease burden in our society at a large, as this disease is escalating due to changing, very fast changing lifestyles, foods, environments, and more. I take the proud privilege to welcome and introduce today's two faculties, Dr. Parimal Lavate and Dr. Ruchir Lavate. It's such a pleasure and honor to have both of you on this session. Um, and let me take the privilege to introduce both of you. Uh, Dr. Parimal Lavate is very well known, of course. He's veteran gastroenterologist from Pune with over 35 years of practice in clinical gastroenterology, hepatology, and endoscopy. He is MD Medicine from the coveted BJ Medical College, Pune, as well as DM Gastroenterology from the Christian Medical College, Vellore. Fellow of American Gastroenterology Association, Dr. Lavate currently heads the gastroenterology department at the Jahangir Hospital and is consultant gastroenterologist at the prestigious Dinanath Mangeshkar Hospital as well. He, of course, has his own clinic where he has been practicing and treating so many different types of patients. And we're really proud to have him here today. He has published many research articles in national and international journals and has also written chapters on gastroenterology and liver diseases in many textbooks. In addition, he has two great mindful hobbies, I would say, very pertinent to today's topic. And that is, he's an avid photographer, and he also plays several melodies on his keyboard. And he, of course, makes it a point to share it with share the happiness with all of us. Welcome to the session, sir. Of course, the other celebrity guest, as I would call him, that we have today out here is Dr. Ruchir Lavate. Dr. Ruchir Lavate is MBBS, of course, but unlike so many other faculties, Dr. Ruchir Lavate chose clinical nutrition to master in and to it's something which is his passion. Treating patients, of course, clinical nutrition is his passion. He is also a fellow in industrial health. But apart from that, he's a trained pastry chef. He's been part of the nutrition team at the BK Valavalkar Hospital. He has devised nutrition recipes for pregnant women, adolescents, and more using local foods. So that's something which is absolutely exciting what he's done. And he's currently practicing at his own clinic. And of course, he's doing a lot of work in digestive diseases, which is why we are very happy to have him here to learn more from both his angles as a doctor as well as a nutrition expert. So, welcome to you as well. I think without further ado, you sort of get to the this important topic. Sir, to begin with you, first of all, we would really like to understand how do we really, how does one come to know that he has IBS? Because I think that's the most tricky question. What are the
Yes.
symptoms?
At the outset, let me thank you for giving us the opportunity for being here and to discuss this very important and common topic. And we are not really going to, there's a lot of hard science in IBS, but we are not going to discuss data and trials. We, like you rightly said, we are going to discuss about an integrative approach where so many things are done to better the quality of IBS patients. So IBS is a very common condition, not only for gastroenterologists, but right from family doctors to primary care physicians. And needless to say that the patient comes with symptoms to us. So these symptoms commonly are, I would term them as ABCD. So abdominal pain, bloating, constipation, diarrhea. So these are common symptoms with which patients come to you. And you have to remember that a lot of these patients, the ones which I mentioned, are predominantly gastrointestinal symptoms, but a lot of these patients have a lot of extra intestinal symptoms. So there may be insomnia, there may be low backache. In females, there can be menstrual disorders, then there can be tingling numbness, and so many other migraines, a whole lot of extra intestinal symptoms. So to summarize, they come with intestinal symptoms and extra intestinal symptoms. And one has to differentiate between a disease and disorder. So these are basically disorders of the gastrointestinal tract. So if you try to do tests, you'll by and large find that these tests are normal. So that is how these patients come to us. There are various ways of diagnosing, if you want me to discuss them here or later.
Sure, I think so. This is something like you mentioned, so in simple language that we can really understand. Also, are there any different types of IBS, and how is it more easier or difficult based on the types of IBS?
Yeah, so there are basically various types of IBS or irritable bowel syndrome. And in very simple terms, they are termed as IBS-C, where constipation is the predominant symptom, IBS-D, where diarrhea is the predominant symptom. And there's a mixed type or the IBS-M, where you can have a combination. Now, amongst the four symptoms which I mentioned, abdominal pain is common to all types. So if you have a person who has constipation but has a lot of abdominal symptoms, then we call it as IBS-C. And if the patient has only constipation but no abdominal symptoms, very common in old people, they have what we call as idiopathic constipation. So it is not a matter of semantics. There are certain differences in treating these two groups of patients. And I think, like you rightly said, there is no single diagnostic test so you can't make the diagnosis of irritable bowel syndrome on a test. So, like for instance, diabetes you diagnose on basis of a high blood sugar. A peptic ulcer you diagnose on the basis of an endoscopy which shows an ulcer. But in irritable bowel syndrome, it is like the name indicates a syndrome or a complex of symptoms on which we can make a diagnosis of irritable bowel syndrome.
Yeah, that also explains to us the the difference between just a disease or just getting an infectious disease, but having a syndrome. So I think uh, both good understanding here for us, and also the other thing is while diagnostics is so difficult in this kind of a case, then out of your experience, um, how can you tell that the person has IBS? By now, I think you probably see the patient and you can look at him and tell that he has IBS. But how does normally a patient themselves have that idea? That they could be suffering something like this, and they need to actually come and see someone like you who has deeper understanding at this disease.
Yeah, so very true. A lot of these patients, like I said, they will come with symptoms. Of late, there are a lot of people who may read on Google and feel that they have IBS, and they'll come and say, "Doctor, I think I have irritable bowel syndrome." They may be right very often, also, not that they will be wrong. But basically, there are two approaches to this diagnosis. Like I said, there is no abnormality which we find in these tests. So there are two approaches to diagnosis. One is which is called as diagnosis of exclusion. So what you do is you do a lot of tests, then you say these are normal and your symptoms are suggestive of irritable bowel. So you have irritable bowel syndrome. But two things here. One is it is not very practical because you can't be doing tests on all patients. So you have to have some way of diagnosing it positively on basis of the symptoms itself. And we will not go into it, but there are criteria which are called as, say, Manning criteria, which are more applicable to Indian IBS, Rome criteria, which were devised through meetings at Rome. And there is a symptom complex which these criteria tell you that the symptoms have been there for a long time, they have been recurrent. So, suppose somebody is having isolated episodes of pain on eating outside or eating spicy food once in a month. It is food induced pain, it is not irritable bowel syndrome. But the frequency is much more, his quality of life is impacted. Then you can make a positive diagnosis of irritable bowel syndrome. But one thing or a one word of caution here is that what we do is, like I said, we can't investigate all patients. So what we generally do is we look for alarm symptoms or any suggestions of what I call as IBS mimics. So there are certain diseases like Crohn's disease, for that matter, even tuberculosis in its early stages, which involves the intestines. So there you can have symptoms which are very similar to IBS, but there can be some subtle abnormalities like low hemoglobin, then nocturnal awakening because of pain or diarrhea, weight loss. So if these symptoms are there, then of course these patients we always investigate. So we don't rely only on a positive diagnosis in these patients. So like I said, do symptom criteria based positive diagnosis. That is the best way. And in selected patients who have alarm symptoms or whom you have treated as irritable bowel syndrome and not responded, these are the people in whom you can do some tests.
Okay, so I think that really helps us understand what alarm symptoms are, and also, so when you, I would like to put this question to Dr. Ruchir, because when you said that there are people who would normally read on Google and then they come and they come and ask you, what we these days observed is that a lot of patients are young. I think IBS is very prevalent more in the younger age group rather, like the other diseases are 50 plus for the 50 plus, but this is something which is more under 50 number is greater. So how do you normally tackle if patients come to you and they self proclaim that they have IBS, and what's the way what do you tell them really in that case?
Yeah, so that happens a lot, and a lot of them do ask me about IBS. They read a lot and come. Uh, if they do have symptoms which align with a classical IBS presentation, I tell them not to worry and that it is something that can be easily regulated and managed with appropriate changes to lifestyle and diet. And in the cases where their diagnosis is not really valid, There are other things that can be taken care of medically or diet-wise. So I counsel them in that way.
Sure. Okay.
Yeah.
Good. So, apart from that, sir, then in such a case, like most of the diseases, is it a better idea to get a early diagnosis? Does that mean that this disease can be controlled or prevented or at least cured at some stage because we early identified it?
Yes, so you actually mentioned three things: control, prevention, and treatment. So prevention is very important, and I think lifestyle plays a very important part in preventing this symptom complex from occurring. And there have been a lot of problems, like you mentioned in your introduction, in lifestyle today. So these are very strong contributors towards development of IPS. So one is prevention, that was what you mentioned. The second thing you mentioned was progress. So this again is very important. And there I think diet plays a very important role in addition to lifestyle correction. And of course, today we are not really going to discuss in depth on medicines of IBS. We are more on the non-medical integrative approach today. And then, of course, you have medicines which we use commonly for irritable bowel syndrome patients. So that is about the progress, that was about prevention. And about treatment. Treatment is generally two things. One is medical treatment, and then there are lifestyle corrections, like which you said. Then there are dietary treatments. In diet, there are various types of diets which you may add or eliminate. And then there's a whole field of nutraceuticals which can be used, like probiotics and so on. So that has been the general approach. And to answer your three questions of prevention, prognosis, progression, and treatment, this I can put as a very short answer.
Okay. So, with that, I think I would like to share a few slides and throw light because you mentioned that this is about more about the integrative aspect. So, what really people understand as integration when it comes to medicine, because this also is fairly new to patients. When you tell them that you're doing something integrated, they're wondering what exactly you're talking about. So, I just thought of laying down these so many complicated names itself. This disease itself at times is so much confused, or rather, there are conditions which coexist with it. Like, these days we talk about chronic fatigue syndrome, fibromyalgia, all these things are at times coexistent, at times, they're confused with this. So, yeah, if you see the slide itself is so confusing that there are so many different conditions, right? Thinking there are people who get non-cardiac chest pain at times and really freak out, or at times they have heartburn, nausea, bloating, which is probably not IBS, and you get sleep disturbances. There are women who are suffering from this, also experience more of the chronic fatigue kind of syndrome kind of symptoms. So when it is so complicated, and the diagnostic tests are like sir mentioned, are more, the functional disorders are really not assessed very well. So IBS being a functional disorder, here if there is so much of confusion, and if there is data which says now that almost 70% of fibromyalgia patients have uh, chronic fatigue syndrome, and almost 35 to 70% of patients with chronic fatigue syndrome have fibromyalgia. So confusing, and at the same time, uh, there is 58 to 92% of chronic fatigue syndrome patients having IBS. So as you see that the disease itself, the diagnosis to treatment itself is so complicated. That is the reason why it is very important that today actually we need integrated treatments. If you see even the risk factors that are there, psychological factors, social factors, of course, genetics it plays a part. Today we are seeing a lot of inflammation. These patients have inflammation, and that actually can lead to several other diseases if they don't eat well. So many factors are in play in this kind of a case. This is why I keep saying that, remember, what is the most critical organ in our body? It's our second brain, which is of course the gut. and that's why we say gut feeling. And gut, why is it brain? Because second brain, because it contains more nerve cells than the spinal cord, and 95% of our serotonin, which gives us a sense of well-being, exists in our gut. Hippocrates was one of the first physicians long ago said that all diseases begin with the gut. So if gut health is so critical, then a multidisciplinary healthcare professional approach is actually mandatory. And so this is what, of course, Dr. Parimal Lavate and Dr. Ruchir Lavate are practicing day in, day out, and which is why it was very important to have them here. But to give
So
my 2 cents to it. So, did you want to add?
yeah, actually, if you look at the way we have been treating IBS for so many decades, when we were students or when we were doing gastroenterology, the whole axis was basically the brain gut axis. So the brain affecting the intestinal tract and the brain being affected by various factors like stress and so on. So we gave a lot of medicines in those days which are primarily focused on the brain. So antidepressants, antipsychotics, anti-anxiety agents. But now over the years, actually, what you have brought out is very important about the gut as your second brain. So now the whole thing is completely reversed. So from brain gut axis, now we talk about gut brain axis. And these disorders, which were called as functional disorders, nowadays they are termed as disorders of gut brain interaction. And if you look at the treatments which we write today, they are quite different from what we wrote 25 years back. And there are a lot of them are focused on the gut. So you may, like you said, nutraceuticals, probiotics, antispasmodics, pain modifying agents at the gut level. So the whole thing has changed from brain gut axis to gut brain axis. And that I think you have very nicely highlighted in the few slides which you showed just now.
Sure. So I think on the gut-brain axis front, we would definitely want to hear from Dr. Ruchir as to what's his experience and some science that you could share with us, and then how do you tackle the whole thing with nutrition as the main therapy?
Sure. So, this gut-brain axis is actually a large topic by itself, and it comes into play in a lot of these functional disorders. So, I've made a few slides as well about these actually. So, uh, so if you see can I see the next slide, please? Yeah, so as we can see, there are three nodes of this gut-brain axis. So there is the brain, there's the gut, and then the gut connectomes, which is the connection between the microbes and the gut. And as you can see, it's a two-way street from both sides. So the gut microbiome influences the brain and its functions, and vice versa. Uh, the gut microbiome, simply speaking, is all the collection of bacteria that live in our guts and that help us to not only digest food, but like you said, produce enzymes and hormones, especially serotonin, and almost 20 hormones they produce. And can I see the next slide, please? So it produces all of these hormones, and the in the immune also has its system. So disorders come from this altered, like serve right disorders. Now they are called disorders of altered, and depression, anxiety, Alzheimer's. These issues are also caused along with the GI disorders.
Yeah, we are able to hear you, Dr. Ruchir.
So in relation with IBS especially, there are three things which trigger IBS from the gut-brain axis point of view. The microbiomes that interact, the food itself, the food relate to tricky.
Okay. We're not able to hear you. Can you sort of log
Yes.
out and log in back? Maybe you can just log out and log in back.
Am I audible now?
Yeah. Yes. But the signal is a bit weak. You're breaking now. So meanwhile, I think till Dr. Ruchir logs back in, I think I would ask a couple of more questions to uh, Sir here. Uh, so basically, like you mentioned, there is, you mentioned probiotics, and of course, we are seeing that enzymes are also gaining importance. So also in terms of different types of drugs, how evidence based medicine sort of works here, because we all keep hearing evidence based medicine, and it is something which has started coming to our consulting rooms as well, that people ask us about it.
Yes, so actually, one challenge with these disorders when you are doing studies on these disorders. So, like for instance, if you are studying a drug on diabetes or a holistic thing on diabetes, you have a substrate there. So, you have a person who starts with 250 milligrams of glucose in his blood, and then you give something which is to bring down the sugar. You can measure the sugar at say 1 day, 2 days, 7 days, 15, 30 days. You can show that it has dropped, and you know that your drug is working. And symptoms may not really have a very big role in deciding whether your drugs or whatever treatment you're giving is working or not. In IBS and all these functional disorders, when you give some treatment, it may be a medicine, it may be some form of cognitive behavior, whichever treatment which you're going to giving to these patients. You have to go by the patient's symptoms. So it's a very subjective thing. So people have devised various ways, and there are some standards of doing trials in irritable bowel syndrome, where you do the trials, and there are fixed set of guidelines like bowel frequency, abdominal pain. There are you can score them, and then you give the treatments, and then you find whether they are beneficial. So it is a little subjective, but you will be surprised that there is a huge number of trials on all the medicines. Of late, there are a lot of trials on alternative treatment also, and things like yoga. So there are trials which people are conducting on these aspects also. And if you look at hard evidence, which is published in good scientific peer-reviewed journals, you find that there are a lot of trials which have shown benefit of so many medicines, be it some laxatives, be it anti-anxiety agents, be it probiotics, or be it some medicine to relieve the pain. So there have been trials for each of these, and there have been a lot of systematic reviews on this, which have shown that yes, these things are definitely beneficial, and then they are proven scientifically. Now, this is very important. This becomes very important because a lot of patients tend to switch to alternative medicine. And if you look at alternative medicine, there may not be really hard evidence. So it is subjective evidence where somebody says that you have these symptoms. Somebody went to that person, then he took some treatment, and then there are a lot of IBS groups also on the net where each person has a different experience with different treatments. So same person, so there needs to be some personalization of all these things which you do when
Yes.
you're treating a patient with irritable bowel syndrome. So a drug A may act on the person A, but it may not act on person B. So you have the diet for person A and person B may be different. It may be to do with his underlying whatever stress patterns, dietary, microbiota, and everything. So these are things which we have to keep in mind. But a brief answer finally, yes, there is hard evidence for medications which we use in irritable bowel syndrome, and we can now use them with confidence on a very good scientific basis.
Sure, I think I will have Dr. Ruchir again present his slides because yeah, we were on the gut microbiome actually, Dr. Ruchir.
Yeah, so can I see the next slide? I hope the connection is good now.
Yes.
Okay, great. So, these food-related metabolites, like I was saying, these three things are mainly what the gut microbiome does. The food-related metabolites, the endogenous compounds that the microbes secrete, and the bacterial cell wall components themselves. The basically how they interact with the neurons is through the signaling of the enteric neurons, that is the intestinal neurons. And IBS happens to be one of the most common manifestation of these gut-brain microbiome disorders. Mm, Almost 10% basically we can say of people in the world experience these symptoms at some point. And along with the gastrointestinal symptoms, stress, anxiety, and chronic pain in other parts of the body are also seen in a lot of the patients. So it's all related to this hypersensitivity and signal processing that happens because of this deranged gut microbiome. And how to get the gut microbiome back on track is basically remove the aggravating factors, which could be dietary and non-dietary and medicinal. The dietary factors are taken care of by a low FODMAP diet, which is the mainstay of dietary management when it comes to uh, IBS. So these FODMAPs are basically, we can go through this right now or later. Uh,
Sure. No, please go ahead because I think FODMAP is something which has been there for a long time, and of course, is it still the number one nutrition strategy that you
yeah.
use?
Yes, it is the number one strategy, and it also gives a lot of success, especially in the short term. In the long term, it's not that it's not successful, it's just that it's a very restrictive diet. Uh, Specifically in the Indian scenario, onions and garlic happen to be high in FODMAP. So a lot of Indians are really disturbed when I ask them to give up onions and garlic from their diet. So what these FODMAPs are basically are they are sugars, starches, or fibers, or basically all carbohydrates that are mm, short chain and they're not digested well in the intestine. So they produce gas and they're osmotically active, meaning that they retain fluid. So this combination of retaining fluid in the intestinal lumen along with production fermentability give rise to all the symptoms like bloating, diarrhea, flatulence, constipation, etc. So by avoiding these FODMAP containing foods, like to name a few, there'd be milk and milk products, wheat and wheat products, certain vegetables like the cruciferous vegetables, cauliflower, broccoli, etc. Mushrooms, beetroot, onion, garlic, etc. Once you remove them from the diet, there's a noticeable improvement in the symptoms within 1 to 2 weeks in most patients. And followed by the elimination period, we have a gradual reintroduction phase where we introduce measured quantities and watch out for any symptoms. And that translates into the long-term approach where we follow a Mediterranean diet, but considering that we are in India, it has to be a kind of Indo-Mediterranean diet and selectively reintroducing high FODMAP foods that they do tolerate.
So that's
How
very interesting.
difficult is it to follow this FODMAP diet?
Other than the onion garlic part, it's not very difficult to follow because mm, the vegetables, as far as the triggering vegetables and grains, dairy products are excluded, you can have a well-balanced diet. It's just that it's restrictive. So short term, definitely a lot of benefits. Long term requires more effort from the dietary planning and management point of view, but it can be done.
Actually, a lot of patients who come to us, they say that gluten is something, means they treat gluten as poison.
Yes,
And
yes.
then,
Yeah.
as we may look at it as celiac disease as one aspect,
Yeah.
but there's a whole lot of gluten disorders which are seen, and gluten is a very common food component in a lot of our diets, especially maybe in the southern states it may be a little less, but it's a very commonly eaten food.
Yeah.
And there's a lot of talk on lay press in non-celiac gluten sensitivity. And so I think, Ruchi, you should tell us about this issue of gluten and how much does it really help patients with irritable bowel syndrome?
Uh, there's a lot of hype regarding gluten in sensitivity or tolerance, definitely these days. And unless you have a diagnosed gluten sensitivity, there's no reason to cut out wheat from your diet. Uh, you can either do it by a test, a TTG test, or you can just eliminate wheat from your diet for 2 weeks. Completely cut out all wheat and wheat products from your diet for 2 weeks. See how it goes. If you feel there's a market improvement in your symptoms, it makes sense in reducing the amount of wheat in your diet long term. Otherwise, wheat by and large is a very nutritious ingredient, so that it doesn't make sense to cut it out arbitrarily.
So
So
I would
actually,
in
if
fact
you look at the
add
latest
here.
issue of gastroenterology, which is our premier journal from the American Gastroenterology Association, there is a whole review article on the spectrum of gluten disorders. And if we have gastroenterologists who are attending this seminar, I think it is worth a read for all gastroenterologists because it is an in-depth review. But in very simple terms, if you have the TTG test or the trans tissue glutaminase test, which is positive, we make a diagnosis of celiac disease, and this is a completely different and immunological disorder which is permanently there with the patient. There is a strong genetic background to it, and these patients need to be off gluten throughout their life. And other than symptoms, it can cause a lot of bodily harm to patients like iron deficiency anemia. Contrasting to this, if you have what he's saying, non-celiac gluten sensitivity or wheat intolerance, these are like Ruchi said, I think we do a 2 week elimination diet, and then if there's improvement, then we can say that this is, and these patients will not have the celiac test positive.
So here's what I normally do while I see these kind of patients. Of course, like he practices, we try to keep them off wheat, and it's interesting to know that yeah, it's very important to eliminate the gluten intolerance. But on the other hand, we have now so many other millets as well. So suggesting to the patients to sort of mix millets and eat them is a good idea. But also at the same time patients normally have stress as to if they should eat half more than half the things they're worried if they should even put it in their mouth. So what happens is people psychologically are actually not are under eating. So there are a lot of deficiencies because of that. So in order to sort of uh, uh, fill the gap, what I normally do is I do suggest protein supplements which are easier to digest and do not have the milk component in it if there is also lactose intolerance. Because normally what you see in the longer periods, especially women, osteoporosis is now very prevalent because if they don't eat enough protein and if they're not eating enough food, then the micronutrient deficiencies are also there. So that's one other way that we can tackle it.
So, since
Of
you
course,
mentioned about millets, as all of us know, our Honorable Prime Minister has strongly promoted millets, and every
yes.
day you find in your newspaper the pros or the advantages of millets in your food. So, if both of you can tell a little about millets in the diet and something regarding to millets and gut health or
Yeah.
millets and IBS.
I think Dr. Ruchiv, you
I think
can.
the biggest pro is that it's gluten free and low FODMAP. All millets are gluten free and low FODMAP. So millets are basically cereals, but they are grasses, but they are not cereals. So smaller seeds than wheat or rice or corn. And there are almost 9 millets that are grown in India. So India is a very millet-rich country. In Maharashtra, we have jawar, bajra, and ragi very commonly eaten, but there are 6 other millets also that are commonly used. So we don't really have much of an issue cutting out wheat because we have so many other options available. And they also have a lot of fiber, soluble as well as insoluble, which helps not only with general gut health but also with things like diabetes, obesity, dyslipidemia.
Sure. So on the other hand, another question, Dr. Ruchir, when it comes to proteins, then because of course these millets do have protein content as well. But how do you normally substitute your proteins? Because normally these patients will have issues with milk and dairy.
Hmm.
Uh, there is a lot of protein intolerance, which is in general seen because there is inflammation and uh, even that fear of sort of eating milk or proteinaceous products. How do you tackle that aspect?
Things are easier when the patients are non-vegetarian because
Yeah.
I can just ask them to eat more of eggs or non-spicy meat products to supplement their protein intake. But if not that, then I do have to use protein supplements, protein powders to add to their protein intake, which is in general lacking in Indians, whether they have IBS or other conditions or no. We do follow a high carb, low protein diet. So it depends case by case. If they are non-vegetarians, it's easier, but otherwise, I do recommend them to have some plant-based or peptide-based formulas.
So I think couple of
If
aspects
if
while
you look
eating.
at protein powder, so they are in big time promotion. And as medical doctors, we are not really into the nitty gritty of the type of protein which is included. Somebody says ours is pea protein, somebody says ours is soya protein. So, how do you really go about choosing the protein supplement? Because each, obviously, the person who is coming to market his product, he is going to say that this protein is the best and you should prescribe this protein. And here you have to remember that the patient is not protein malnourished, but he may require a little more protein. So it's not like a cirrhotic where you want to give big amounts of protein. So how do you go about choosing these protein supplements?
So, yeah, this is what I do. Is I believe if it's a normal patient, if it's depending on the IBS patient, it's going to be personalized, of course. But normally they should consume proteins from all sources so that it's non-vegetarian source, the dairy source, and as well as the plant. Again, plant protein is good, but there's too much of hype around that as well. So having a mix of all three in foods is good. In the supplement, it's when people are normally not able to digest proteins, it's better to have easily digestible or pre-digested proteins and take some sort of a digestive aid with it. So ideally, having a combination of whey with a plant is actually a better idea. And the idea is they should get all the amino acids out of it. So that's the most crucial thing we look at. I prefer giving multivitamins with it so that the general uptake is better. Also, these patients have micronutrient deficiencies. So if they consume small amount of micronutrients every day, it's like eating a normal micronutrient rich food instead of trying to take supplementation for that as well. So that's usually my approach. Dr. Ruchi?
Hmm. Yeah, like you said, if they are meeting their protein targets through food, well and good. Otherwise, plant or even actually whey protein does suit some people with IBS because it's basically lactose free by the time it reaches to the whey protein powder stage. If they still have an intolerance to that, then peptide based, pre-digested formulas are the way to go.
The reason also we give formulas is because most proteins, if we realize, if you're giving paneer, for example, or any protein for that matter, except for egg white, you look at, they will always go with a fat along. So fat is again a component which is going to be difficult for IBS patients. If we can cut down on that, but at the same time introduce good fats, is the trade-off that you have to play around. So that's why, eating lean meats, a lot of times people still go and try to eat the chicken leg piece instead of trying to go for the breast part, which is lower, which is more leaner protein. So leaner proteins uh, are less bothersome to in IBS. Am I right, Dr. Richard? Uh, you
Yeah,
can
in
add
fact,
something on the non-veg component.
the non-veg component, since you mentioned chicken, a lot of people do think that any and all parts of the chicken are healthier than, or low fat than things like mutton. Whereas mutton, a lot of mutton actually does tend to be lower cholesterol than chicken. So it depends on the cut that they are having. Fish is the safest option usually, which I do insist on, or egg whites. But even within chicken, chicken breasts or then the lean cuts of mutton, I do ask them to limit them and have a variety of their protein sources, some poultry, some meat, some fish, vegetarian proteins as well. It's the PDCA score that matters. If you take care of that, sorted.
Sure, I think PDCA score is something which again people are unaware of. If you could sort of give a little bit of insight on it as well.
Okay, so it's the quality of the proteins are classified, and the protein digestibility score is called the protein digestibility amino acid score is the PDCA score, and it's common knowledge that animal proteins are better in quality and uptake availability for the body than plant-based proteins, so they have a higher score. But within the plant groups, also different. Plant groups or vegetarian protein groups have more higher or lower scores. So you could ask the patients to, I do ask the patients to make better choices. Like soy protein has the highest PDCA score uh, amongst the plant protein sources. So I do ask them to take those rather than just dals or something like that.
So I think the other question also people normally have is about soy protein. Is it good or bad? Because that's again a very big question mark people have.
Okay, so yeah, the scare about soy protein comes mainly from the phytoestrogen content that it has, the plant-based estrogen content. So a lot of the males are worried that they will see a dip in their testosterone levels from consuming a lot of soy. And what I usually tell them is that East Asians, China is the largest, was till now the largest populated country in the world, and they've been eating tofu
Yes,
day in, day out for
right,
generations. So you really need not worry about that.
right.
An 8-ounce serving per day is basically what is considered acceptable, and it does not uh, seem to decrease the cholesterol levels, testosterone levels in the body.
So
Actually,
I
one
think
thing which I like about soya bean, unlike many other, is that there are so many formulations of soya bean which are available. And I don't have great knowledge about cooking or something like that. But you have soya chunks, you have tofu, you have these soya puffs, you have soya bean powder, which you can add to your various components. So that is, I think, one additional point which I would like to add over here.
also, it is better to add soya protein with whey if you're taking combination because it becomes a little more economical. Given that whey supplements are very expensive, instead of adding a maltodextrin filler to it to reduce its cost, it's better to add soy protein, which will give you more arginine and glutamine. Because otherwise, we see people trying to consume additional glutamine and arginine when they're trying to build muscles. So if soya is already giving it to you on such high grade, why choose it? Don't
That is
worry
true.
so much about it.
That's a very good point that, rather than maltodextrin, soy protein should be favored.
Good. So I think another question I had for both of you rather is that in this complicated or rather difficult disease, what we call it, how much does a patient and doctor sort of relationship matter, and does it have like a placebo effect? And I think Dr. Ruchir, being a doctor yourself and a nutritionist, are you able to tackle it more more better? What do you want to add? Both of you want to add to
I think there is a psychological component, a strong psychological component to IBS. So, giving the patients time and hearing them out, making them feel heard is very important because it instills a sense of confidence in the doctor, in their minds, and that itself brings about a sense of relief. And stress management is something that a lot of IBS patients do need to do, and once they start doing, it shows benefit to them.
So I think,
it. So,
as
yeah.
I would say that if you have a peptic ulcer inside your stomach, which is proven, anybody who gives medicines for it, like a proton pump inhibitor, and the patient takes it for 4 to 6 weeks, the patient is going to get cured. So it is hard science, hard pathophysiology, definite substrate to treat. And contrary to this, there's a lot beyond medicine. So if you look at the science of medicine, the art of medicine, I think science of medicine is definitely very strong in organic disorders where you have something to treat, right from diabetes to GI disorders. But when it comes to functional disorders, I think the doctor has to leave his experience, his wisdom, the science about that disease, and the art of medicine, most importantly. So there can be very small things like if you have a very thin lady who comes to you with IBS and she's looking very frail, if you write very big tablets or something which has high potency, it may be normal for that particular dose, then they may be put off. They might feel that this is a strong medicine. So there are so many things about art of medicine, and that is something which you actually learn and evolve over years. So I think irritable bowel syndrome, the most important thing is beyond medicine. It tests your art of medicine and dealing with patients and being a more holistic doctor where you listen to the patient, you try and find out what is the patient's family background, psychology, the whole picture of the patient, and try and address it accordingly.
Absolutely, and I think uh, given you all being such busy gastroenterologists, having an integrated approach becomes even more important. To be dealt by doctors like Dr. Ruchir, so that and going deeper into their psychology and psyche is so very important. With food, I think it becomes easier, isn't it, Dr. Ruchir? So it's easier to make them feel more happy because food does make people happy, right?
Yeah.
So I think.
Along with that, stress management is also important. So I would like to hear from you, in fact, what are the strategies that you employ for, counseling patients about stress management and this thing, other than, just a passing remark that you can try yoga and meditation for.
Yeah, you're absolutely right because I think first come first when you talk about stress management, I think the first thing that you do is when the patient comes to you, you talk to them, you understand them well, try to mitigate the stress there itself, and a lot of times try to be more understand what their personal and professional sort of background is, and then try to
Mm.
address, try to find out those stress elements in first place. And
Yeah.
I see a lot of such patients land up crying in their first or second sessions that they're having with you. It's unfortunately or fortunately, but they let out their stress that way. I think that's first thing that we should be doing. Then, of course, trying to give them a good understanding about simple breathing exercises. That also in situations we teach children that they should count 10 counts when they're in such situations. So I help them do that. There is a lot of stigma, that corporates especially they feel sitting through meetings or anything for that matter, the burps or the bloating, all of those issues are sort of shameful for them. To first make them understand that they are going through this, and to be able to mitigate that, they have to first stop stressing about the smaller
Mm.
things, and then sort of resort to, of course, yoga and stretches. Yes, those at least those 2 3 hours of at least I even tell them that exercise in the morning, but in the evenings go out with your family for walks, and that way start sharing what your day was like, and all these simple things can actually help stress bust. So that's what I use typically. And of course, yoga is a good integral part, but no one can sort of immediately jump to it.
Yeah.
Is what I realize, having known yoga closely for quite some time now. So that's where we are, I think. I think we've been able to discuss most of the aspects of this disease, normally not addressed because, unfortunately, not much time has been given to this topic. I don't know, but Dr. Lavate can actually tell us and sort of help us conclude this session. And sir, with your permission, I think we should probably have more other alternative treatment professionals on this kind of a session next time, and have such discussions on IBS.
I think what you said is you hit the nail, I would say. It is very common disorder. It affects the life of a patient, the quality of life of a patient. A lot of us are busy doctors, and then there can be a tendency to brush off these patients by writing some medicine. But they do require a hearing, they require dietary advice, and so many other advices. It may not be just about hearing the patient's history and the complaints. Once you know the patient, there are a lot of things related to his personal issues which they come up with. And you may not always have solutions, but listening to the patient also is part of a solution for the patient. Body language is something very important. So, to have a little dismissive kind of body language for these patients generally does not augur well and does not lead to cure. And over the years, what I found is that probably if you give me a patient with some disease and a patient with disorder, what gives more satisfaction is probably curing a patient with a disorder, functional disorder, and irritable bowel syndrome, which is definitely more difficult to cure permanently. So it gives more satisfaction. I may not be wrong by saying that it gives more satisfaction than curing diseases where there's a medicine which, anyways, is going to work for that patient. And lastly, like our topic mentioned, I think it has to be a little, two things have to be there. One is it has to be a more integrative approach where the medicine part, art of medicine, and these other features like diet, exercise, lifestyle, stress management, they are added. And the second thing is about personalization. So each IBS patient is different. Although symptoms may be same as to what we mentioned in the beginning, the background which leads to the symptoms, the diet which leads to the symptoms, the sensitivity of that patient to various diets. So all these things are very different. So I think I would end by saying that a holistic integrative approach. And the second thing is approach where you try to understand the patient and then tailor your treatment and other factors as per the patient's needs. So this is what I would say actually.
Sure. So, building faith and strong relationships between the patient and healthcare providers is one very critical process. And we've heard that from Dr. Lavate, who has been really a pioneer expert here, who has been practicing for so many years. And we have Dr. Ruchir Lavate, who has been doing this holistic practice so very well. And actually, we are very fortunate to have his generation people picking this holistic approach. So it becomes much easier to take it really forward very well. So I would like to thank you both on that note for being here and spending your time and effort on actually educating. From our side, our promise is that we will try to reach this program to as many so that as many get benefited out of this. So thank you so much
Thank you
again.
very much. And thanks to all the audience who have spared their valuable time to listen to this.
Sure.
Thank you.
Okay.